Hi, how are you? Joanne, I'm back here again. My name is Joanne Pikova, and today we're looking at evening primrose oil. Why evening primrose oil? Why should we look at it and the like? So, what's its benefit? Do we really need it? And yes, we need it. That's why we're talking about it. So, evening primrose oil. The reason we are looking at it really is because in the last video we talked about polycystic ovarian syndrome, and we said we're going to go further and look at the treatments of polycystic ovarian syndrome and the various supplements that we can use, of which evening primrose oil is one of the supplements that we can use for treatment of some of the symptoms of polycystic ovarian syndrome. For example, the periods and the irregular periods. Yeah, so evening primrose oil is a plant. Actually, it comes from a plant, from the seeds of a plant. So evening primrose is a yellow flowering plant, native to North and South America, some parts of Europe and Asia, and the oil is gotten from its seeds. So the thing about that oil that's gotten from the seeds of the evening primrose is that it is very rich in omega-6 fatty acids, and omega-6 is an essential fatty acid. So yes, we have a lot of omega-6 in our diet, but there is a very peculiar difference with evening primrose, as I'm going to explain. So evening primrose contains omega-6 fatty acids, and two types of omega-6 fatty acids. 70% of evening primrose is linolenic acid, which is almost all the other oils that we use. All the vegetable oils have linolenic acid, and actually, and it has about 10%, 5 to 15%, or 10%, between 5 to 15% of it being gamma linolenic acid. So now this is the peculiarity of linolenic as of evening primrose. So I've said the other vegetable oils like sunflower oil, the oils that you use to fry your food, contain linolenic acid only. So most of the omega-6 fatty acids that we take in our diet daily are linolenic acid. But then evening primrose has both linolenic acid and gamma linolenic acid. Now, what makes evening primrose very peculiar is that actually our bodies have to convert the linolenic acid to gamma linolenic acid in order to do a variety of functions. So it's like the active form, one of the active forms of linolenic acid, it has to be converted to gamma linolenic acid. Now that's what makes evening primrose so peculiar, because it's a rich source of gamma linolenic acid, of which other sources of omega-6 don't have gamma linolenic acid. So yeah, like when we talk about omega-3 and omega-6, we usually say, yeah, omega-6 we usually take it in our diet, but guess what? We take in linolenic acid instead of gamma linolenic acid, and it needs to get converted to gamma linolenic acid. And then there are factors that prevent the conversion, or that slow down, that affect the conversion of linolenic acid to gamma linolenic acid. One of those is age. As you age, so as someone ages, they really need to supplement with a gamma linolenic acid. That means that evening primrose directly, as we are going to see, gamma linolenic acid performs a variety of functions in the body. So as a woman ages, as a man ages, they actually would rather take the gamma linolenic directly, because their bodies are unable to process or they are limited in their processing of the linolenic acid to gamma linolenic acid. So that's what makes evening primrose so peculiar. So every elderly person should be. Another thing that affects the conversion of linolenic acid to gamma linolenic acid is sicknesses. People who have chronic illnesses, also their body is unable to properly convert the linolenic acid to gamma-linolenic acid. So that's one of the other factor. The other factor is a dietary deficiency. If you have a problem with the intake of food, of which most people have, like really they have some dietary deficiency, maybe they take a lot of fats more than vitamins and stuff like that. That also affects the conversion of linolenic acid to gamma-linolenic acid. People who have viral infections, some diseases, and also very many other conditions would prevent that conversion. So that you find that the peculiarity, the advantage of evening primrose is the fact that it contains gamma-linolenic acid, and though it contains linolenic acid, is its ability to have also gamma-linolenic acid, of which almost all the other oils just have linolenic acid, and evening primrose has gamma-linolenic acid. So let us look at some of the benefits of the gamma-linolenic acid that taking in evening primrose will help with. So the first thing is the gamma-linolenic acid and linolenic acid are an essential component of what we call the myelin sheath. And the myelin sheath is that protective coating around the nerve. So the myelin sheath is that coating around the nerve fibers and the cell membrane. So the GLA, the gamma-linolenic acid, and then the linolenic acid are essential components of the myelin sheath. So a deficiency in those will create issues with the myelin sheath, and yet the myelin sheath is supposed to protect the nerve membrane, help in the conduction of impulses. So if someone, many studies have been done about this, and it shows that when you treat people who have diabetes usually have nerve pain, there's destruction of the myelin sheath, and when you give them evening primrose for a period of between 3 to 6 months, and when other conventional treatments have failed, you find that evening primrose is very effective to give to people who have diabetic neuropathies or diabetic nerve pain. And further to that, when they carried out what we call nerve conductive tests, they showed a rapid improvement. They showed a rapid improvement in nerve conduction when patients or people have been given evening primrose. So if you have someone, or if you have a client, if you have a patient, or if you're one who has diabetic nerve pain, evening primrose is really very, very essential for that. Okay, then the other thing is that so it improves the symptoms of people with diabetes, the nerve pain symptoms, the neuropathies, but also it's because it's part of the ingredients of the myelin sheath. The other thing is that it helps with maintaining the GLA, which is the most essential part of evening primrose. The gamma-linolenic acid will help in the maintaining of the joint and cell structure. So the GLA is converted. So when you take in a linolenic acid, it is converted to gamma-linolenic acid, which ends up also being converted to arachidonic acid, and arachidonic acid gets converted to what we call prostaglandin E1, which will regulate the immune system. It will also regulate joint inflammation and fight off inflammation itself. So it helps in the production of prostaglandins that will help to regulate the immunity system, especially prostaglandin E1, help to regulate inflammation, and also and that way. So this helps in the formation of arachidonic acid, which leads to the production of prostaglandin E1. That will really be helpful. The other thing is that GLA itself, the gamma-linolenic acid itself, also suppresses inflammatory cells. It has other than the prostaglandin pathway and things like that, it also suppresses the inflammatory cells itself. Okay, so that's one of the reasons. That's one. So we've so far looked at two benefits: that diabetic neuropathies, nerve conduction, and also helping with the joint pains, and helps with basically regulating the immune function and suppressing inflammation. The other thing evening primrose oil does is that it helps to increase the production of cervical mucus. It produces prostaglandins, so it helps to increase the production of cervical mucus. And cervical mucus, the consistency, the thickness, the consistency of the cervical mucus, the intensity will help to provide an ideal environment for the sperm to survive. Some people do not give birth. Some people have issues with infertility because they have a hostile cervical mucus. So evening primrose helps in the production of cervical mucus that provides an ideal environment to help support the sperms to survive. Remember, the environment within the vaginal canal is very acidic and can easily destroy sperms. That's why sperms come with prostatic fluid, but also the cervical mucus should be of the right pH, the right intensity, and the right thickness, and that to allow sperms to nourish and enter properly into the birth, into the uterus. Yeah. So the thing, though, that you should note is that you should not take evening primrose during pregnancy, because guess what? It improves muscle tone, so it can easily lead to relaxation and contraction of the uterus. So yes, it can help you have the child, help improve the cervical mucus, but the moment you get pregnant, you cease taking it. So it's used in preparation for pregnancy and not during the pregnancy itself. Okay, so many people who have eczema do not have GLA. Actually, they find that most people with eczema do not have the right, what do they call it? The right ability to process fatty acids. Many people with eczema do not have the right ability to process fatty acids. So this results in a deficiency in LA. So remember, I said GLA. Remember, I said that ALA has to be linolenic acid has to be processed into gamma linolenic acid. Now, people with eczema have that, they have like a deficiency in their ability to process linolenic acid into GLA, and yet GLA leads to gamma linolenic acid leads to it has anti-inflammatories, and it also leads to skin elasticity and prevents itching and all those things that are associated with eczema. So if you have someone with eczema, you would give them evening primrose to help with their skin. First of all, it's an anti-inflammatory, but it also reduces itching and that flakiness of the skin. But also, so because those people have the inability to process the fatty acids, they are deficient in gamma linolenic acid, and evening primrose is the richest source that we have of gamma linolenic acid. So if you have someone with eczema, that's why usually when someone is even taking evening primrose for something else, for example, for periods or what, their skin usually glows, because it helps with the skin intensity, moisturizing the skin. Even in primrose, omega-6s are very good with moisturizing, but it's also an anti-inflammatory and things like that. Okay, so the other thing is that evening primrose helps prevent what we call premenstrual syndrome. So women who have PMS or premenstrual syndrome have an impaired conversion of linolenic acid to GLA. Like, you can't believe, yeah, that's true. So they have usually, that's one of the causes of the irritability, the moods, the what and what. And yes, okay, there is also a hormonal thing, and the good thing about evening primrose is that it helps to regulate the hormones that are usually also working in a certain way. But also, one of the research shows that one of the contributing factors for PMS is when someone is deficient in gamma linolenic acid, and the reason someone is deficient is because they cannot convert the linolenic acid that they have into gamma linolenic acid. So when you supplement them with evening primrose, it's able to help alleviate the PMS symptoms and especially the ones that also are associated with breast tenderness. Now, the thing about this is that you don't only give it for one cycle, you have to give it for several menstrual cycles, for example, 3 to 4 or 3 to 6 menstrual cycles, so that then the body picks it up, and you're able to regulate the PMS symptoms. So it's not that you're going to take it for one menstrual cycle and then the PMS is all gone. So it remember that, and that's some of the information that you need to give to your clients. So it best works when used over several menstrual cycle. So even primrose also improves blood flow to the legs and heals or reduces the size of venous ulcers. So it helps. So those things of varicose veins and what it helps to improve blood flow to the legs, but also reduces the incidence and heals actually the venous ulcers. Then another most important thing is that when a study is done in alcoholics, they find that they are deficient in a substance called prostaglandin E1. And remember, linolenic acid to gamma linolenic acid, which even in primrose has gamma linolenic acid, which is eventually converted to arachidonic acid, and arachidonic acid produces prostaglandin E1, of which most people who have been abusing alcohol are deficient in. So even in primrose will lead to the production of prostaglandin E1, and this prostaglandin E1 will help to improve liver function. So studies have been shown that when you give alcoholics, someone who has had alcohol withdrawal or someone who has been abusing alcohol, and you give them evening primrose, because it helps in the production of prostaglandin E1, it will help to improve their liver function. So those are some of the other uses that are really different from PCOS. So what does it do in women health? We've already talked about the premenstrual syndromes, but also even in primrose mimics progesterone, and because it mimics progesterone, and one of the functions of progesterone is maintaining the uterine lining, you find that women who experience those heavy bleeding, frequent periods will be very much helped with evening primrose, as it will help to at least elevate the progesterone levels, counteract estrogen dominance, and therefore be able to maintain the uterine lining so that someone doesn't keep bleeding all the time. Now, also the fact that also, and its anti-inflammatory effect also help with polycystic ovarian syndrome. So the fact when you elevate the levels of progesterone, the levels of testosterone go down. And remember, PCOS is mainly associated, polycystic ovarian syndrome is mainly associated with androgen hormones. So when you give someone evening primrose, the androgen hormones actually reduce. So you find there'll be a reduction in acne. You'll find that there'll be a reduction in some of the symptoms and pain associated with polycystic ovarian syndrome. So evening primrose is one of those supplements that are very good for pain, very good for the skin, very good in people who have diabetic neuropathies. Oh my goodness. Very good for the joints. Very good for fertility. Very good for women's health. So we have evening primrose at any fine pharmaceutical outlet, and you can reach out to find out more information. Bye bye.